Welcome to the ACE Hot Topic webinar titled Breast Cancer, Global Quality Care, publication by OUP. I am Jen Wood, Meetings and Administrative Manager for ACE, and I have a few housekeeping items before we begin. We hope you will join us for the International Oncology Leadership Conference being held November 15th to the 17th, 2020 in Rome, Italy. Also, don't forget to mark your calendars for the 27th ACE annual meeting scheduled for January 31st to February 2nd, 2021 in Palm Springs. Please visit the ACE website, www.cancerexecutives.org, for more information about either of these educational offerings. This webinar is being recorded and will be posted to the members-only section of the ACE website. We will be holding all questions until the end of the webinar. So if you think of anything during the presentation, please submit your questions through the question box on the GoToWebinar toolbar. It gives me great pleasure to introduce today's webinar speaker, Dr. Didier Verhoeven. Dr. Didier Verhoeven is a medical oncologist working at AZ Clinic Antwerp, Belgium. He is head of the Department of Medical Oncology Clinic and is currently clinical director of the breast clinic Voorkempen, which treats nearly 300 new cases of breast cancer a year. Dr. Verhoeven defended his PhD thesis about breast cancer, tumor cell proliferation and stromal changes in breast cancer at the University of Antwerp in 1992. In addition, he obtained a master's degree in medical and pharmaceutical research at the University of Brussels. He has written many papers about oncology, especially about breast cancer, in international and national peer-reviewed journals. Although he is a clinician, part of his work goes to data management and quality improvement programs. In January 2014, he was appointed as guest professor of medical oncology at the University of Antwerp. In February 2015, he was the driving force and chair of the 5th International Congress of Breast Disease Centers in Antwerp. And in 2018, Oxford University Press accepted his book titled Global Breast Cancer Care Quality for publication, which was released in November of 2019. We hope you enjoyed today's webinar. Please take it away, Didier.
Thank you, Jen, for this nice introduction. So, dear colleagues, dear friends, welcome to this hot topic webinar organized by the Association of Cancer Executives. The making of our book was really a story of passion, of a global world and giving knowledge to each other. It was a story of trying to find solutions for affordable breast cancer care for all women in the world. During the webinar, I will tell you shortly the story behind, the possibilities of the e-book. Okay, sorry. Yeah, the possibilities of the e-book, something about the content, and then finally and the availability of the book. Our story began in June 2010 in Paris, where we were invited by Marc Espier, a French medical oncologist working in the Hôpital Saint-Louis in Paris. And at that time in France, there were major cancer institutes like Villejuif, but no really integrated breast centers. The first International Breast Disease Centers Congress was organized in January 2011 to work on this. And since then, the last 10 years, a lot of expert meetings during congresses were organized in a lot of cities in Europe with a lot of world-renowned experts. And to mention here some of them, you see here Eduardo Casap from Buenos Aires, past president of the Union for International Cancer Control, and Nagi El Sagir from Lebanon, distinguished as fellow of the ASCO in 2018. Kari Kaufman, co-editor and past president of the National Accreditation Program for Breast Centers and co-editor. Mauricio Magalhães Costa, president for the Cynologic International Society from Rio de Janeiro. Raghu Ram, President-elect of the Association of Surgeons of India, Robert Mansell, past President Uzoma, and also co-editor and Lee Tucker from the US. So you see a lot of top experts worldwide were involved in the project. And especially during 3 different congresses, which we organized the last 10 years regularly in different European cities about things as quality, economics of breast cancer care were organized and the problem were discussed. The International Congress of Breast Disease Centers in Paris mostly, and one time in Antwerp. The Congress about breast cancer in Aachen in Germany. And now the last years also the Congress of the IOLC, which will be now end of the year in Rome. And it was not only during these congresses, but also during the preparatory meetings, a lot of discussions were made about programs over management and organization of worldwide breast cancer care. And during the special meeting of the 2016 Breast Cancer Conference in Paris, the decision was made to start a project bringing the ideas of the organizers together about the organization of breast centers in a global world. Now, the aims of the project was to deliver a comprehensive guide for high-quality breast cancer care around the globe, to focus on the highest possible care within the local resource limitation, to give a multidisciplinary outlook, and to develop a guide for developing a breast center wherever you live, with the possibilities of your countries. Now, we had a faculty of 115 top experts coming from 25 countries from all the world, from the 5 continents, which work together to make this a really success and to give a holistic view about the organization of breast cancer care. And it was Professor Mansell who suggested to me in Aachen to suggest the projects and the topics we wanted to discuss on one of the big publishers in the world. And I quickly was involved and was challenged by, impressed by Oxford University Press to choose them as our publisher. And because I was impressed by their origins, going back to the beginning of the printing to 1468, it is the largest university press in the world, giving academic and educational publication and also now a lot of online products. So then begin the story to trying to have our publication get an Oxford University Press. And in the coming 2 years, and Caroline Smith, with this commissioning editor from Oxford University Press, was my major contact person, with who I had a lot of discussion about every aspect of our project. The style, the number of pages, the color, the cover, the illustration, the price even, the chapters, and how to organize it. Meanwhile, we worked with all the faculty members, the 115 members, on the content of the chapters. So we had a lot of discussion about content, about what to do with all the different things and to organize it. And then begins the very difficult, extreme difficult review process, in essence, a review of the content, the style, and the originality of the work by the Oxford University Press. We must be the first book treating a specific subject, and it must be original. And the first round of the review process we passed 20 February 2017, because the 6 reviewers worldwide from the US, the UK, and Europe were all 6 positive. There were critics we must change, and there were a lot of points we have to clear. And then it was a second round. We go to the second round, and we passed the second round with all our comments and reviewers 12 March 2016, and it was in addition, in total we get 9 reviewers. There was then agreed that we can go for the publication. And then some month later, our project was approved by the publishing committee of the press, and then 8 May 2018, they were pleased to say us that our project was approved by the delegates of the professors of the Oxford University. So that make my day. So then we have to sign the contract, but it was only available without a lot of work, phones, websites, Skype conferences, all the people in the 15 experts in the different countries working together to make this a success. But most important was one global team to see that everybody can work together from the different continents. We had a fantastic secretary, and we had also a medical science writer to see that the English, the chapters were homogeneous, and there was one homogeneous point. And then, so as I say, the contract was signed 5 July in Oxford, in the presence of Caroline Smith, of Janine Fisher and Rebecca, which are also assistant editor and the PR express of the Oxford University, especially for our projects. That was middle of 2018, and in the contract was stated that it must be ready. 14 January. We must have the script submission, and we had to work very hard with all our experts, but we did it, and the script was clear in the beginning of 2019. And then there must be checked if all chapters were okay and if all the permissions were there. And then the last part begins in June 2019 by Jansi Sivarai, which was the project manager from Oxford University, to really make the book, to do the pre-editing, to do the art assessment. There was also another copy editor, Robin Watson, to go around all the pages, all the chapters, to see if everything was in a good language. There were no things forgotten. There was after also the proof review again to all the authors. We have to discuss which is the best cover. There was also an index. So it was a big work in the coming months. And then finally, we could have the publication of the book, which was then ready for publication. 14 November 2019, the book came out at the press. And we had then the first man buying the book during the ILC Congress in Antwerp. It was Clifford Rhines from Just for Cancer, an organization supporting people financially with cancer from the US, who was the first man to buy our book during our Congress. But publishing a book is just the first step in the journey. And this webinar is one part of the other steps in the journey to make our project a big success and to come out with the ideas of the book. So another point in the journey was the launching of the book, which was 7 December, last December in Antwerp. It was with a big conference with more than 500 people and with an international debate with people of South Africa, Asante Kwanele, with Pankaj Roy from India, with Shala Massoud from the US, Sabine Siesling, co-editor from the Netherlands, Robert Mansell from the UK, myself, and Francesca Van Thiel, who moderated the discussion. So that was one of the events we organized for the launching. And that was the first thing, how we went to the book. The second point, which I like to tell, is the ebook. The journey went further, and the book, the ebook, was coming out this month. You can go through the platform. The Global Breast Cancer Global Quality Care is available on the Oxford University platform. It is a digital platform hosting Oxford University Press most prestigious medical titles, and the online version is available for subscribers. Now, the chapters can be navigated via the contents menu on the left. Here you see the contents, how you see how it looks like. The figures appear within the text and can be made larger with a click. And figures can be downloaded as PowerPoint slides to use in lectures and presentations. Like this. That's on chapter 1 about epidemiology. And here is an example of what boxes and the tables look like. All websites are hyperlinked, so the reader can click straight through the web page in the book and they come directly in the web. Cross-references within the text are hyperlinked to the relevant chapters, heading or figures. And reference numbers are linked to the reference list at the end of the chapter, and you can go then directly to the reference. And returning to chapters most relevant to your search term are also possible. So you see, you can do a lot of things with the ebook, and it's very challenging to use it in the new world. And also it's make the availability across the global world very easy to handle. So the last part of the webinar, I like to go quickly through the content, and I choose 1 or 2 figures from the different parts of the book to give you an impression of its content. And I just show some tables, figures, messages as example, and highlighting especially a little bit the US contribution, which was very good and large. If you like to know more, just read the concerning chapter in the book, as it were, of course, the authors who make the content. I was their advisors to see and to go what I really wanted to have in the book, but they were responsible for what is in it because they are the top expert of their chapter. So part 1 is about epidemiology. It is written by Isabel Sorio-Materan from the World Health Organization, of Claudia Alemani from London, which make the figures about epidemiology of breast cancer in the world. And that's, for example, a table about the estimated cumulative risk of being diagnosed, gray bar, and dying, a dark bar, from breast cancer among women before 17 by world region. That are the Globocam figures. So you see here, that's of course not good because the bar are not so far from each other, and that's of course better. Now, part 2 goes about quality management and how to organize quality management. And there is 1 chapter. It's about the National Accreditation Program for Breast Center Vision, which was chaired by Carrie Kaufman. And this, for example, in the table, say the components of a breast centers, which they think must be present, as in the US must be adapted. Breast program leadership, multidisciplinary providers, breast conferences, guidelines, databases, equipment for diagnosis, improvement programs, research facilities, and community outreach. That's as example. Then part 3 goes about guidelines. It was written by Benjamin Anderson from Seattle and give an overview of all the different guidelines of breast cancer, of ESMO, of ASCO, and also here they give the guidelines of the National Comprehensive Cancer Network, and they putting the guidelines, they state the development process, the grading of recommendation, the review cycle, and the setting the target, US global annual grading of recommendations. So for all the guidelines are putting next to each other, that you have a good idea what of guidelines are present in the world. And it's remarkable that there are many guidelines, but not the guidelines are very good adapted, or is a little bit a gap between the guidelines and how we can have it in the community. So, and at the end of each chapter, there are key messages. Sharp and clear recommendations with always attention of the different levels of income. In research-rich environment, for example, there is relatively little variation, although uptake and compliance vary widely between, and in some cases between and within institutions. Resource-satisfied guidelines provide an approach whereby evidence-based treatment approaches can be adapted to existing practice environments in low-middle income countries. So the key messages are a little bit the essence what is say in the chapters, and you can go through it and then go to the chapter himself. Now, part 4 was written by Terry Sarantou from the US also, and it's about the multidisciplinary meeting, which we think is the jewel in the crown for the organization, the breast cancer care worldwide. And it's even as important in low, middle, and middle income countries than in high income countries. And here you, for example, in the figure, you see the type of treatment modifications as a percentage of total change made following discussion at the multidisciplinary meeting. And you see that 42% of all cases presented received changes of treatments. So this is highlighted also and stressed the very important point of the multidisciplinary meeting in changing what you must do. Now, in part 5 goes about quality control in the different disciplines in radiology, pathology, surgery, reconstruction, radiation, genetics, 9 disciplines, systemic treatment. And here, for example, it's one of tables about the radiology, and Hans Junkermann from Heidelberg, Germany, they made together with the experts of the chapter comparative utility of imaging methods according to tasks. Interesting for also all different countries, middle, low income countries. Mammogram, the golden standard, when MRI, very needed, screening, high risk. In the other part, not so important. So you can really have what is the best, and we can use adapting your resources. Then we have a table about pathology, which was coordinated by Shala Massoud from Florida, with special consideration for breast conservation and sentinel lymph node biopsy. The guidelines, the process indicates as quality indicators. For example, what is important that you see percentage of pathology reports, including margin status, ductal carcinoma in situ, lymphovascular invasion, percentage of diagnostic discordance between intraoperative and final pathological diagnosis for sentinel node. So you see they put together what they think is really important and what must be quality controlled. Then we have about reconstructive surgery, was written by Mauricio Magalas Costa from Brazil. Oncoplastic surgery has 4 levels of competence. You see the 4 levels. They say it's important in oncoplastic surgery. Breast surgeons should be prepared to work with level 1 and 2, but the ideal is to have a full training to manage all cases scenarios. And then a chapter in radiation therapy by Philip Portmans from the Curie Institute in Paris. Requirements for infrastructure, staffing, workload, before, since, for example, full-time radiation oncologists per department, minimum 3. Really practical recommendation how to handle, how to organize the care. Qualified radiation physicians per department, now minimum 2. Patients treated per year, radiation visit, maximum 500. Really figures and things to go through. Now, the part 6 about health information technology, say what's very important in organization, all our clinics, but especially also for breast cancer, say so many things about the quantified self. Personal data are exploding with 60% exogenous factors, genomic factors, clinical factors, so much data about patients that it is very difficult to go through and to understand all the things. So you must have help in interpreting the data. Another point in the health information technology is the major challenges related to tele-oncology, which can be very interesting for developed countries for really expert analysis, but also for low and middle income countries. But there are pitfalls when you organize it, for example, by Sub-Saharan Africa. And the chapter was organized by Groesbeck Parham, who is professor in the US, but comes from Tanzania. Local technical expertise remains essential. So you must have experts present in your countries, even to process specimens. You must have also their personnel to maintain equipments. It's not so easy about IT collaboration. You must minimum computing and image capture technologies. Stable source of funding to maintain and replace equipment over time as required. It's not so easy for low and middle income countries. Unpredictable internet service provider outage and high cost of internet service. So you could think, oh, that's very easy and that's a very good idea to do it to low and middle income countries, but there are important challenges to have the good IT services, and you must also have expertise at the local, locally. So part 7 goes about the research, another important part of breast cancer globally. And we discuss here, for example, the world map with the number of performed clinical breast cancer studies, which is, of course, highest in the US, in Europe, but we see that that China is really coming, and with more and more clinical breast cancer studies are doing in China. So, and these chapters goes about how to organize breast cancer trusts and what are the global challenges. Then the economic part. So this figure shows the incremental cost effectiveness plane and cost effectiveness acceptability curve, showing a cost effective curve of an intervention, and with the incremental cost and the probability of being cost effective on the y-axis and the willingness to pay threshold on the x-axis. So if this is very, very cheap, the willingness to pay is of course very high, and that's an inverse relation. Then here you have a part, it was a chapter about the economic impact of breast cancer in Southeast Asian region, and a study performed and discussed by the authors showing that there is in those regions in the world 60% of financial catastrophe 12 months after diagnosis of breast cancer. Because this global book also about low and middle income countries, we stress the problems worldwide of economics and of budgets. And then we have part 9 about the part of patients, physicians, and media, which was written by Dana Atai, which is surgeon also in the US. In one of her statements, I stumbled upon conversation among women trying to find answers to very basic questions that I felt should have been answered by their physicians. Some women were truly uninformed, but many were simply overwhelmed. And we had on the nice illustration of The Cry by Edward Munch with the US and UK version, and it was handled by our photographic poet, which was Robert Parry-Downs, which is also a medical oncologist and which is make such photographic poetry. And then another chapter is the figure about medical legal aspects and influence on quality by Robert Mansell showed that there were about 70,000 claims settled in 2016-17. What happens with really trials? It's not really much trials. That is a minority. Mostly it is no proceedings. Proceedings 31, trials really 0.7. So it gives an idea how claims are settled and organized in that chapter, which because medical legal aspects are an important aspect in the quality control, which good things, but also bad things for the quality. So you see that in the US, there's a lot of punctures in the breasts to be sure that they are missing nothing. So it has an influence on quality. And then the last part about the governments in Europe, in US, in Africa, in South America, and there is the part in the US written by Lee Tucker and also Teresa Heckel. And that is a figure stating the relationship between governments and advocacy in the development of health policy access and funding in the US. And now there is an interaction and what is responsibility of the state and the responsibility of the advocacy and the interaction. And also what physician clinicians, physician executive, what are their, what they can do. You see here the physician, the clinicians have more value autonomy, identified with specialty, independent decision maker, advocate for private practice. When they are executive, they more value collaboration. They are more identifying themselves with program, a skilled delegator, advocate for breast centers and practice planners. So there are different attitudes of physician as clinicians or executive. And the chapter goes further on these things. And then, for example, in the chapter about India, important aspect that was written by Raghu Ram from Hyderabad in India, they introduced a mobile phone breast app reaching many people in India because most people have an app. They try to go really to everybody with a mobile app to reach population, make them concerned about breast, what is breast cancer, and trying to reach people and for better knowledge of that breast cancer is something existing, because many people in India don't really know what it is, or have no idea what it is. So that's I really went quickly through the content. Of course, you must go through the book really, and you can, but so you have any ideas about what is going on. Now, the availability of the book, you can go online and have it online by Oxford University Press or by Amazon. It's nearly, I think, 50 euro. It will be $45, $40, and you can command it, order it online, and it will be yours in some days. So that was my story. Thank you. Jen? Questions?
Thank you very much, Didier. If anyone has any questions, you can either email Didier at the email address on your screen. Otherwise, if you have any questions that you would like him to answer while on this webinar, please go ahead and send them through the question toolbar, through the GoToWebinar toolbar in the question box.
No questions?
Yeah, Didier, I think you gave all the attendees a lot to think about, but thank you so much for everyone who has joined. And again, please feel free to reach out to Didier directly through his email listed on the screen in front of you. And thank you so much, Didier, for this presentation, and I hope everyone has a fantastic day.
Yes, I hope everybody enjoy and feel really free to mail me, because I think we try to go further with the project, and we have as many people on board, the better. Thank you.